Hello beautiful people out there. Welcome to the first episode of Life is Beautiful channel, and this is Sunita walking you through the talk. Today's topic is healthy living, and we are going to interview Dr. MURTHY, who is going to take us through this topic. Welcome to the show, Doctor. We are truly honored to have you here with us. Doctor, at present we are going through uncertain times with COVID, Omicron and other variants drastically affecting the quality of our life and the way of our living. Social life has gone for a toss, and mental fatigue, feeling of helplessness, worry, fear of the future has set in. So how do we keep ourselves fit, healthy and safe and optimistic during these uncertain times?
Thank you for the question. Now you mentioned optimism at the end. I think let's start from there. I think we have gone through 2 years of lot of misery, uncertainty, fear of so many things, and we can only say that at this stage, this year, we are at an optimistic stage to look at life from now for further. Now, with that in mind, not to demean or belittle the sufferings we had, I feel personally that a lot of things we have learned from this last 2 years of very, very difficult times. To me, I think we need to look at three things. One is the health, second thing is the mind, and third thing is how to take whatever we have learned and see if we can incorporate in the future. Now coming to the health itself, our health has taken a hit for various things, but at the same time I feel it has given us some insight into how to look into it in the future. One of the positive things I think we had from this isolation, if I may say, is that it has brought the family together. All of us were locked up in the small rooms we had, and we learned so many things. The most important thing is that we are able to see that we can either enjoy each other's company or at sometimes get irritated. And we have somehow learned to actually make sure that we live properly, and that's the most important lesson I think I have learned, which I think we should take it further in the future. Being together has been a great boon. We have learned to see how we can share our work at a time when there were no servants. We become much more active to look after each one of us, and let us not forget that we should forget all these things which we have learned in the lockdown time. Coming to the mind again has been a very, very difficult thing, and I can clearly classify into, let's say, 3 or 4 different categories of people. One is the people who have been working at home, the other people who had the fear of losing their jobs when the whole thing stops, and the third group of people where they had no idea what's going to happen, or I can really sympathize with some of the business people and small workers where they had no job and they had no income. And lastly, I have taken some interest to look at people on the streets. So what have I learned? I have learned that we can still be okay, and if we can able to cope from the lessons we learned. It is possible to actually share our mind with the people whom we know. It also gave us an insight into what other people think, people who you have actually made sure who your real friends are, whom you can depend and whom you can socialize. The mind has also been in a position where we are able to think beyond just the 4 walls and the close quarters. I know a lot of people who have actually learned new skills, be it cooking, so that either you make new dishes or the husband or the male members take part in the cooking, and we also share. I'm sure a lot of us have had that mind to share with others who are suffering, and I have personally been outside every week during the peak of COVID to distribute food to almost 300 to 400 people every afternoon, and we found that everybody there were waiting, and these are people who had no means of going anywhere. They were on the streets, and it gave me and my family that we should take care of these people. And these people had no income, and it has definitely, if I am sure all of us have felt this, and this pandemic should at least make sure or sensitize us that we should be able to look after the people who are unfortunate. The other most important thing which I found was with so much of time together and time to ourselves, there was nothing to do from the morning till evening. I'm not talking about people who are working from home, I'll talk about them later, but people who had the luxury of having time, it also gave us an insight into looking at the nature. I personally found I could make time out between let's say between 3 o'clock to 7 o'clock in the evening, which I had never seen. As doctor, we are actually working during those times, and it gave us an insight into what happens in nature. I have noticed that the birds which come around, they have a specific pattern. The crows go to rest first, then they are followed by pigeons. I have seen rows of pigeons sitting just opposite to my house. I was very astonished to find that each pigeon sits actually in the same place as it is, because we could notice the slight variations in the color of the pigeons, and they used to fight for the same space where they rest for the night. We saw parrots coming up after that, and I was very thrilled to see the chirping woodpeckers used to come after that, play a beautiful dance and then disappear. Lastly, when all this is over, just when it is dusk, we could see huge bats, all of them, thousands of them going again from one place to another. So it gave us an insight into look at nature, which we never did before. And I hope most of you would have also done that. And I request all of you to make sure that this habit is taken in the future and spend some time with nature, because that will help us a lot. Then of course, we also had the opportunity of looking at the stars in the sky. We could see and identify some stars in the sky, which is nice to look at. So this pandemic has taught us a lot of lessons, and I think with this end of the pandemic, hopefully these lessons will be learnt, and forget all the bad things we went through. Look at in the future to look at all the things which we learned and go forward.
Very good, sir. Doctor, another thing is, weight gain is a problem that we are facing due to work from home and sedentary lifestyle. And what are the ways we can combat this?
Yeah, I think weight gain has always been a problem, especially so during and for people who are working from home. I have seen even my own relatives and friends who are working from home. I pity them, and I think it is not a good idea, because at least previously they used to go to work, they used to have some physical activity, they used to go to the workplace, they used to socialize there, they used to come back home. At least the work used to finish at 5 o'clock or 6 o'clock or the time they come home. Unfortunately, the work at home during the pandemic was a cruel one, because they were available all the time. They were being flogged, and I think they used to work. There was no specific rest time for them. They were available all the time, and I think that has taken a big toll. And people, I found that some of them even did not have time to have meals. And I know personally, either the wife or the mother used to feed them while they are working. So I think that is a bad thing which learnt, and that is one of the causes for weight gain. The other causes of weight gain, I feel, is that as I told earlier on, we explored our cooking. We actually started making a lot of new dishes, and the bad thing is that instead of looking at healthy food, we did things which was the easiest way. A lot of fried food was used, and I think this is one of the causes of weight gain, coupled with no physical activity.
Okay, doctor.
So I think this is mainly for the people who are working from home and had no leisure time. And I think a lot of other people had the opportunity to make use of this in the right way, I would personally think that a lot of people took advantage. They learned, it helped both ways.
Yeah.
People who were ready to teach them online, they came up and they actually shared their knowledge. People who were eager to learn new skills, like as I said, cooking or even music or dance or aerobics or physiotherapy, these people actually did a great job. They actually did new skills. They made sure that they had a good schedule.
Developed new skills.
They developed skills, and then they also had a pattern where they actually kept, because they were worried about weight gain, they also made sure that they did a lot of work.
Okay.
And they actually kept themselves drip and fill.
Right.
So basically they could not go out, but inside you can still do. So I think that's the lesson we need to learn.
Very good.
Which I think we will continue. So I think that's the important thing.
Now, doctor, children and adults likewise have started snacking up, leading to binge eating, and this again has affected their dental health. What are your tips for dental hygiene?
Yes, I think see, children particularly have suffered a lot because they are always so active and they need a lot of place to run around and they need people to play around. So being stuck with the four walls, I think this has really made them a big problem for them. And not only binge eating, but it's just that eating becomes a part of spending time. And the easiest thing was for the mothers to give them something which is available.
Yeah.
And this has not helped the children. One, they not only put on a lot of weight, but also the snacking, actually having food at untimely timings and the type of food they had. So the one thing which is particularly very bad for the dental health is the carbohydrates and things which are sticky.
Yeah.
So for example, toffee, chocolate and the sticky stuff, they also stick to the teeth.
Yes.
And it's very important that you wash the mouth properly, and especially when you go to bed and if you had a snack, these things stick to your mouth. And these high starchy and fatty food will actually cause acid formation, which will literally burn a hole in the tooth. So that is called the caries, but caries is nothing but having a hole in the tooth. So this acid producing stuff is very bad for the teeth. It is important that they wash their mouth regularly, but more importantly, avoid it during the night.
Okay. Doctor, now another thing is eye strain.
Yes.
That is also increased in the recent past, and recently it has increased a lot. So what has happened is we are spending too much of time in front of the screen.
Right.
In front of gadgets like mobile, laptops.
Yeah. So that's another. See, the brunt of the problem is borne by the spine and the eyes. And eyes is very, very important, because especially for growing children, it is very important that they don't they have a proper what is called eye hygiene.
Right.
Just like hygiene of the hand and the other areas, we also call what is eye hygiene. And this starts with two things. One is the screens which you look at. You tend to look at the screen at a constantly. So two things happen.
Yeah.
One is you're looking at the screen and the light, which not only emits light, but also emits heat.
Yes, of course.
And looking completely straight into the screen, which causes the eye not to blink. So one of the most thing of eye hygiene is to keep blinking. So please keep blinking. Every now and then see away from the screen and keep blinking, because the tears are very important. One of the problems we face with children or adults who are working on the screen is that they have red eye.
Red eye, okay.
They have itching of the eye, they have redness of the eye, and they have watering of the eyes.
Okay.
So all these things we avoid by simply making sure that you look away from the screen and keep blinking.
Okay.
So there are three areas in the eye which you have to be very, very conscious about. One is the lids. The second thing is eyeball.
Okay.
So just like how the whole body keeps moving, the eye also has to keep moving. And again, the second thing about eyeball is the eyeball has got very specific muscles which move the eyeballs in various directions. And if you keep looking at the screen in one direction, all the muscles will become strained. They become strained.
Okay.
They become tired and they become very, very stiff. So the simple exercise to do, make sure that these eyeball muscles are properly
please share them,
exercised.
doctor. Yes.
Very simple. All you have to do is there are 3 sets of muscles. One set to look at to move your eyes from side to side. So take your eye away from the screen and then look to the right, look to the left.
Okay.
You can do it about 3 to 7 times or 10 times.
Okay.
Keep a number and then keep doing it. So 1, 2, 3, 4, 10 times. Then there are set of muscles which will actually move the up and down.
Up and down.
So look up, look down, look up, look down, look up, look down. Count to 10. And then you can do sets of 1 or 3
Okay.
depending on that.
Okay.
Then there are another specific muscles which will actually make you look on the sideways up and down. So look up, look down, look up, look down. Similarly, look up on the left up, right down, left up, right down. So this again you can do. And to top it all, you just do a complete circular motion in the eye. Start from 12 o'clock, do a nice round motion, 3 like this and 3 like this. So if you do that, the muscles will get relaxed. So don't keep looking straight.
I'm already feeling relaxed doing these exercises. Yeah.
So this is a very simple exercise. I said there are 3 areas which are important, which is under your control. So one is eyelid, blink your eyelids.
Yes.
Second thing is move your eyeballs. The third most important thing is what actually happens to the muscles inside the eye itself, which actually focuses and changes the lens inside, so which works on the lens. So that has to be relaxed as well. So there's one important term we use here which is called accommodation. Accommodation means ability to focus.
Okay.
So once you focus, then these very specialized muscles actually get the whatever you're seeing under focus. You would have seen in a mobile also, once you quickly take it, it is out of focus and then becomes. But the eye is such a specialized structure, you don't see and you never see anything going out of focus because it's so perfect. So what it does is it actually keeps moving the lens up and down in such a way that your eye, whatever you see, is always under focus. But that comes under a lot of at a big price. That muscles has to be relaxed. If you're looking at one spot all the time, that muscle again becomes stiff. That muscle again becomes tired, and then you'll have what's called eye strain. So the third part of that is to make sure that you relax that third muscle, which is right inside the eye, and that you can simply do by looking at. If you're looking at the computer or the screen, look away at a distance. Come back again. Look away distance. So when you see anything object which is very far away, preferably you can get out from the room, go to a window and look at the tree or look at the sky. The further up you see, the eye will be relaxed. So these 3 things are very important. So get out of the screen even for a short period of time, once in 2 hours, once in an hour, whatever time. So go to the window, look at the trees far behind, and then look at the sky. And then do the simple eye exercise. So these 3 things will actually help you a lot.
Okay, doctor. Another thing is mental stress has increased a lot.
Yes.
Anxieties, worries, fear of the unknown has also increased manyfold during these times. How do we combat this?
Yeah, I think the COVID has produced what is called a survival reflex or something, where you have a lot of people actually it's a very big survival instinct. We don't know what is going to happen.
Yeah, right.
And again, like I said before, there are various categories of people, right? For some people, it may not be very much. But some people where they have a fear of losing their jobs, they don't know whether they're going to have a job
very
after
real
that.
fears.
People who are self-employed, people who have their own businesses. When there is nothing, there's no savings, this was a real problem. And of course, you have other people where you are allowed to work long hours. So you have a combination of people who don't work, who don't know whether they're going to go to work at all. Right. Other people who have too much working and they have stress. So how to get an in-between? So again, this is what I think you should do. The advantage is you have support from the family.
Right.
And sit down and talk to them. I'm sure somebody will help. A lot of NGOs have helped.
Okay.
The most important thing is your elders may help you to talk to you. And in extreme cases, I think you should seek psychiatric help. Actually the number of online consultations for psychiatrists has been the maximum. During the COVID, if you see, there have been the people who have been extremely busy and they have helped them a lot. And I can personally say that a lot of psychiatrists I know, they're doing a great job. You don't have to feel bad seeking a help from a psychiatrist. Right. They are people who will understand what you do.
Yeah.
And if you really think that you are you need help, you need to get them.
Okay.
The other ways of getting over stress is, everybody has got stress. The point is, you get stressed once you know when the stress doesn't stop. So
Yes.
all of us know there's a time when you may stop.
Yes.
So as you rightly said, the stress becomes unbearable once the timeline passes. So we all knew that the COVID may end sometime in 2020.
Yes.
Then they said end of 2020. Then it became 21.
21.
So the timeline is important. So the way to cope with stress is to make sure that you be optimistic, take things in the real sense, do things
Easier said than done.
much easier said than done. But at least sit down and then contemplate what to do, and then seek help. So if there are a lot of people who will actually have been helping financially, mentally, and whatever needs you need. And socializing has been a problem.
Yes.
And unfortunately, friends and family are also a great mental stress busters,
Right.
and that has been a problem. So hopefully that will not happen.
Okay, okay. Doctor, another problem is a large population of our generation, our students, teenagers and young adults. What would be your advice for them?
Yes. Yeah. This has been a huge problem. In fact, I have seen a lot of students who joined first year as a undergraduate student,
Yes.
and they are going to pass out without stepping to college.
College.
So I think that's a
So
big.
they lost
that's a
out
big
on
problem.
college life.
So they have completely lost on the fun of going to college, the fun of being
Interacting with.
interactive, explorative,
Yeah.
fun, and
Yeah.
everything associated with this is lost. But again, the good side is not individual. Everybody has gone through that.
Yes.
So you don't have to feel bad. I think there will be an opportunity to do something else. The biggest worry is to me is that you have lost on the skills development. So I think fun part apart, I think you had to be very serious about it. You should say that what is it I have lost? And to me that's what I tell people. I said, don't worry, you can always have fun at a later time, but 3 years of your solid time you have lost learning a skill.
Right.
So I think the biggest consolation is that you know that everybody in your peer group will be the same.
Right.
So you have to get back and try to go. And I hope that in the last 2 years you have made some sort of an assessment of what you have done, and then try to go ahead. I think that's the only way to look at it. So that's a big problem. People have the children, especially school, college students have been a problem. So, but again, a lot of them actually sat down and then rethought about it, and they are trying to rebuild their life.
Doctor, I remember you showing us some exercises for keeping our muscles straight and all that. Can
Yeah,
you just
yeah.
share that with
Right.
us, please?
So the other problem with either children or people working from home was making sure that they have a proper exercise. As I told you about eye hygiene or eyesight hygiene, dental hygiene, we also have to make sure that the most important thing in the body is 3 areas: the neck, the spine and the limbs. And the first thing is, if you are working from home or even sitting and doing nothing, the spine has to be kept
Straight.
properly and straight. And I remember that when I went for some yoga classes, there's a very old yoga master. He said the yoga is nothing. It's not that you have to go and learn asanas. He said yoga is nothing but if you are sitting in a chair like this,
Yes.
just sit straight.
Straight. Yes.
So the focus should be on spine. So he said, don't worry about anything. Whenever you are sitting somewhere, just make sure your spine is straight. Make sure that the limbs are the legs are nicely resting on the floor, and don't slump.
Yes.
So I think that's very important. So make sure the spine is straight.
Spine is straight.
And again, very simple 3 exercises.
Yes.
The spine, you just completely bend forward and then bend back. You
Okay.
can do 3 times, right? This is for the back.
Okay.
And then turn around 3 times. even while sitting. Do this every half an hour or even 1 hour, you will find that your back, everything is much better.
Okay.
So most of the things happen because the muscles actually get into a stiff state.
Okay.
As I told you, like how the eye muscles get into
Strain, yeah.
Same thing, all the muscles get to
Muscles
strain.
of the body. Yeah.
When the muscles get stiff, then the joint pain starts.
Okay.
So most people start rubbing ointments on the joints.
But that's
actually
temporary.
it's not the joint. If you keep your muscles active, the joint will automatically get lubricated. It will actually work. So the muscle activity is important. So the most important thing for the spine is to just bend forward, bend back, and then twist for the spine. Then comes the neck. Neck, very simply what you do is, again, it's got about 3 or 4 exercises. Bend your neck fully down. Get your chin to touch the chest. Go back fully. Do that 3 times. And then lift it to the sides. Rotate it to the sides this way. 3 times. And then give one final rotation all through the neck this way. So if you do that, it doesn't require any exercise. It doesn't require time. It doesn't require a place to go. You can do it as you're sitting. And again, so I told you about the neck and the spine, and the third is about the hands. You can just do some exercise with the hands. Most important exercise with the hand is to keep your hands mobile. Elbow mobile. And then lift it up. And then you stretch out like this. So as it is, you find even now, when you do that, you feel better.
Yes.
Then the legs, of course, stretch your legs, lift up, stretch it up, and finally do a final stretch like this, fully. If you can get up and do this, it's fine. Otherwise, keep your spine straight. And then just stretch out. So any muscle needs a lot of stretching. So the muscles in the eyelid, I told you, had to stretch. Muscles in the inside the eyeball, they had to stretch, and all the muscles have to stretch. That should be fine.
Last but not least, doctor, what would be your advice for seniors, retired and aged parents? Your tips for their well-being?
I think they have also suffered quite a lot. In fact, I have been involved in a lot of these old people calling me for various reasons. They may be sick. As a plastic surgeon, I have been involved with a lot of people who have been lying down. They are sick. They get bed sores. These are the one group of people who need extra care. Compounded with this is when they develop COVID. So nobody is allowed to go inside. One nurse used to come. Suddenly she doesn't come. Nobody goes inside. So these are the problems we faced. Hopefully they are out, but in case you are faced with the problem of somebody who's got a bed sore and you need a nurse, I think you have to make sure that the person who is not moving very much has to be mobile. Everything is mobile. Just make sure the person is moved every 2 hours.
Not in one position.
Not in one position for more than 2 hours.
2 hours,
All you have to do is, you may buy expensive beds, but more importantly, you have to change the position. Very important. Then nutrition, make sure they are eating well. So that is one group of people I have come across where we have helped them, and all of us have been very generous with giving them advice on the phone. We used to take phone calls, and thanks again to WhatsApp calls. We actually we are able to see them inside their bedroom or wherever they are and give them advice. So that is one group of people. Second group of people are people who are parents who live alone. Right? That's another very big group. They may be physically partly active, but mentally also they may be frustrated. My experience is all they want is somebody to just say hello to them. Just to say hello to them. Especially if they have children, they just need the children to talk to them every day, just to say hi, hello. That lifts up their spirit.
Being connected is what they want.
Unfortunately, you will find that these people may not have their relatives or their friends who they have been friends with. Even I know that in my own house, we had two people, two of my father's brothers, they passed out. So it has a lot of pressure on them, and they just need somebody to talk to. So mentally, I think they need that. Other things, I think by now they have figured out how to do. They know how to take care of their own mental things, but they need social at least
Social
contact,
network.
at least. So just say hello to them once or twice a day, that's all they need. Then of course you have people who are single and elderly and who are living with children and grandchildren.
Yes.
So this is probably the good things to see, but not does not happen all the time. But even there you find that the old parents need to have their
We may
own
be
space.
living in the same house, but we
Yes.
won't be interacting much, I
Exactly.
guess, with them. Yeah.
So that is a big problem. So they need to be cared for so appropriately.
Okay. Okay. So, doctor, we have learnt a lot from you. It's been a real enriching session with you, and I'm sure all my viewers will be greatly benefited and will try to implement your advice and valuable tips towards their everyday life. All your advice were simple, doable and easy to follow and implement. I will definitely implement it for sure in my daily routines, and I'm sure my viewers too will. Thank you for spending your valuable time with us, doctor. Thank you.
Thank you a lot.
Yeah.
All the best.
And with that, we end today's video. I look forward to your valuable comments, as my next video will be a continuation on healthy living. This is Sunita signing off. Until then, take care. Tata. Bye bye.